Afternoon and welcome to today's audio cast, Navigating Employee Benefits in an Evolving COVID-19 Pandemic. My name is Eric Daly and I'm a consultant with Multnomah Group, an institutional retirement plan consulting firm. I'm pleased to have with me several partners from Faegre Drinker's Benefits and Executive Compensation Group. Faegre Drinker may be a new name to some of you, but represents a recently completed merger of more than 1,300 professionals and two well-known law firms, Faegre Baker Daniels and Drinker Biddle and Reed. Last week, Multnomah Group hosted a webinar about the market environment and immediate impacts of the COVID-19 virus on employee benefit plans, the sponsors who manage them, and the participants who utilize them. A recording of that is available at multnomahgroup.com. Since then, the impacts of the pandemic continue to become more clear, and two additional pieces of legislation have been agreed to that will have an impact on many aspects of the employee-employer relationship. In today's audio cast, we will take a more in-depth discussion of how the changing landscape will impact retirement plans, health and welfare plans, severance agreements, and executive compensation programs. Joining me on today's audio cast from Faegre Drinker are Heather Abrio, Summer Conley, Maureen Malley, Mike Rosenbaum, and Eric Vogt. Since we're all in this together, today's audio cast will be focused on addressing the immediate questions you as employers are facing. Accordingly, on the Zoom platform, you will see the ability to submit questions. Please don't hesitate to do so at any point during our discussion today. Additional housekeeping, we're recording today's audio cast. We've muted your lines to maintain the audio quality. We'll also provide a link to the recording for your review or to share with others in your organization. A couple of additional housekeeping items on top of that. Today's presentation is going to be focused extensively on employee benefits relative to the COVID-19 virus. We did get some submitted questions relative to FMLA, which are beyond the scope of this particular presentation, although there are some very good executive briefs from the Faegre Drinker team on those topics as well for those that are interested. So with that, Mike, maybe I'll start with you. We're getting lots of questions from plan sponsors about their next committee meeting. We've had some cancellations already, and from an ERISA perspective, should we leave as clients and plan sponsors our meetings on the calendar or push those out to a time where things have calmed down a bit?
Okay, well, Eric, and thanks for organizing this and including us. We appreciate it. So my thought on that question, it's March 26th. The quarter is going to end on March 31st. So for most of our clients that have regularly quarterly committee meetings, that meeting's not going to be scheduled until sometime in May or early June. So my advice on that would be to leave it on the calendar for now and to recognize that in doing so, we're at a period right now where there's, obviously, if you look at investments and plans, the returns are down, in fact, down significantly in some cases. And so, under the ERISA law, the way that you protect yourself from a participant lawsuit or Department of Labor audit or something like that related to investments not performing, properly or fees being too high is to obviously, if you can be right about picking the investments all the time, that would be great, but that's hard to do. So the way the ERISA law gives you protection is to say, have a process and follow it. And from a fiduciary committee standpoint, your best defense and your best process is a regularly scheduled and completed committee meeting. So my advice would be this is not the right time, even though I know people are busy and people are focused on doing everything possible to keep their businesses going and fight this COVID-19 virus. To have your committee meeting, I think, and continue the process is extremely important in today's world.
So maybe let's take the other half of that then. So let's say, like for many of our clients, you did meet in late January, early February. You were looking at some pretty gaudy return numbers. The S&P was up, well over 30%. International stocks up, well over 20%. Should committees be calling special sessions or special meetings, or wait until their next regularly scheduled meeting that might not happen until May or June?
Yeah, so I've gotten that question from a few clients as well. And, I think if there's a level of concern among plan committee members to have a quick call for an hour just to get everybody together, just to get some comfort from you as their investment consultant or whoever they use, that their fund lineup is in decent shape. It might not be a bad idea. And I guess I'd throw that back to you, Eric. Are there things right now that you would want to say, to committees, hey, here are like, I know there's 50 things you could worry about, but like in the market that we're in today, are there some quick things that you would say to them if they were to have a meeting that you'd want them to cover?
Yeah, on the fiduciary side, to your point, when equity markets are off, 20% over the course of 2019, looking at the relative performance of whether your manager was 100 basis points better or 100 basis points worse, probably given the short time period is not a real relevant measure. I think, if you go back, for those of you who are managing plans back in 2008, 2009, I think ultimately the same playbook from an investment perspective is going to be, particularly relevant here, meaning that the real issue is in a diversified defined contribution stance, at least, making sure that the cash preservation or capital preservation options will maintain their integrity through this cycle. So if you're in a money market position, given the changes in regulations, you're likely safe there. If you're in a stable value position, what are the liquidity restrictions and what impact will the changing rate environment and the quality of the bonds that may make up that portfolio ultimately have an impact on participants there? And if you're in a fixed annuity position, are there any issues relative credit quality there? I think participants do begin to look at those more safe options. And again, with all equities off, the real test or challenge is going to be, did I not have a place that I could have gone to, could have diversified away from to try and get into a safer stance? And I think it's probably a pretty good transition to the next question that we're getting frequently, and like your feedback on, Mike, which is there's a lot happening to employees. The question that I think many plan sponsors have is, given the amount of market volatility, the impact on the retirement plan, should we be reaching out, communicating with, doing things for participants during this time, knowing the competing priorities for their attention given all that's going on?
Yeah, and I want to get to that, but I want to go back to just one more comment on what you were saying about, if you were to have a committee meeting, what you would talk about. And actually, even if you don't have a committee meeting now before your next meeting in May or June, when you're looking at putting together stuff for that May or June meeting, I think one of the things that you'd want to talk about as a committee is, what are we doing in terms of participant education if you haven't done that in a while? What kind of investment advice are we giving to plan participants, and how's that being delivered? Probably through your record keeper or maybe a third-party investment education or advice provider, right? I mean, that's, as a fiduciary, selecting someone to provide investment education or selecting someone to provide investment advice, that is a fiduciary responsibility, and you have a duty to monitor them. And what a better time to monitor them now than, obviously most of our clients are doing that on an annual basis anyway, but it's a really timely time to bring that up at the next committee meeting. And I think that ties in to the questions that you're asking, right? And I mean, our advice, and I'd be curious what you're thinking, but our advice really, I think, is sort of threefold. One, we're not recommending employers put together any sort of investment education or investment advice piece, right? Like, don't do that yourself. You don't want to be in that business. You've hired somebody to do that for you, probably your record keeper, but maybe a separate investment education or advice provider. And if they are providing advice, I think what we've also seen is those vendors are providing a lot of information. And if there's some way that as an employer, you could present that to employees in a more manageable way, or maybe, Eric, I don't know if that's something that you have some thoughts on, but how do you, as a plan sponsor that uses a record keeper or somebody else, how do you get how do you put all that information together in a way that's usable to plan participants?
Yeah, no, that's been the real challenge is, while I don't have to commute to the office every day right now, I do have to wade through probably 3 times as many emails as I did 3 weeks ago. And most of them are every organization that I've ever done business with in the last 20 years telling me about their continuity programs, their COVID resources, which is fantastic, but I do think it's overwhelming. One of the things we've encouraged clients to do, and we've done for them essentially, is gather the resources that are already available from their provider. Because to your point, Mike, we're trying to avoid having clients provide investment advice, even with the best of intentions, to participants directly. So trying to help plan sponsors be aware, and those that interact directly with participants on the benefits teams, give them the resources to redirect participant questions to more dynamic solutions. And I think, again, if that comes directly from the employer, even if it's setting up a special page within your benefits infrastructure to address what we obviously hope is a very temporary phenomenon, but a pretty meaningful one for the time being, so that participants can much more quickly, without having to wade through a lot of legalese from their provider, the resources that are already there and being customized for their needs. Hey, Heather, I know you've been watching closely both the CARE Act and the stimulus bill that was passed by the Senate, I think this morning or last night. We're already seeing participants wanting to access their retirement accounts as a result of the fallout from the epidemic. How will distributions change before and after the eventual passage of the stimulus bill?
Hi, Eric. Thanks. Actually, it'll change. Well, let's talk a little bit about what it is right now. A lot of 401k plans have hardship distribution provided for in their plan documents, and they allow their participants to take those hardship distributions out. And what some people might have forgotten about is, back 2 years ago, there was some hardship distribution final regulations that came out. And for effective as of January 1st of 2020 this year, there was a provision in there that said an individual could take out a hardship distribution when there's a federally declared disaster. So I actually have already had conversations with a couple of plan sponsors about this. And right now we have federally declared disasters in California, New York, and Washington per FEMA. So if you are an employer and you have employees in those states, you would want to, take a look at that, because they could currently take a hardship distribution. What's important to note is that the hardship distribution can be made for expenses and losses incurred by the employee on account of the disaster, provided, however, that the employee's principal residence is at the time in one of those FEMA designated disaster zones. So that's kind of important. That is something that is current. Your plan might not have been amended for it because it wasn't required until 2021, but it is currently available if you do have hardship distributions. Now, one important thing to note is it only applies to expenses incurred by the employee. It doesn't, apply if their designated beneficiary or their dependent or somebody else has expenses. Of course, a plan that doesn't have the safe harbor, there are current non-safe harbor provisions, and you would just have to make that determination if, the expense or loss is a deemed immediate and heavy financial need. If, for example, you have an employee in a state that has not been declared a disaster zone by FEMA. So that's where we are right now and today, if somebody wanted to take a distribution. What we're looking at as far as the passage of the CARE Act goes, and we're assuming that, what we've looked at is basically going to be what's passed and what was approved by the Senate, there are going to be what we'll call the coronavirus distributions. Of course, we have to put a name and a label on everything. If an individual or a participant takes this distribution, there will not be that 10% penalty if they're under 59.5, which would normally apply in other situations. It cannot be over $100,000. They can repay, they're not required to, but they can repay it over 3 years, or they can take it into income over the next 3 years. Now, what's important to note is that the individual, it can't just be all participants can take a distribution. It's not opening up the plan, which I think has a little bit of that has been in the media lately, that, hey, we're opening up all the 401k plans and everyone's just going to take everything out and have a, there does have to be some sort of, there is a definition about who can do this, and it's an individual affected. Either that individual has been diagnosed by SARS or COVID-19 by the CDC. There also can take it out if their spouse or dependent was diagnosed, or if they experience adverse financial consequences from quarantine furloughs or layoffs, or their work hours were reduced, they couldn't get childcare, or if they individually had a business or operated the business that was affected. So what's important to note there is they're just going to have some sort of employee certification requirement there for those, what we'll call the coronavirus distributions. There's also going to be some loans that are going to change if your plan has a loan, allows for participant loans. I know, some folks over the past couple of years have tried to limit the loans, but it's going to open it up a little bit. It's going to allow for loans up to $100,000. It used to be $50,000. The loan repayments between now and the end of the year, December 31st, will be delayed for a total of 1 year. But however, it is important to note interest will continue to accrue. The 5-year limit will be disregarded, so there's no longer that 5-year term that the loans have to satisfy. And again, this is not just for everybody. This is going to be for an individual who qualifies under the criteria that I mentioned before. They're diagnosed, their dependent or spouse is diagnosed, or they kind of had those adverse financial consequences.
So would you have to amend your plans, Heather, for those before you could take advantage of them, or could plans that have already loan and hardship provisions operate in good faith?
Yeah, it's going to be very similar, Eric, to what happened with the financial, the hardship distribution regulations that came out. They will need to amend their plan ultimately. However, there is guidance under the CARE Act that says, they can administratively operate their plan in accordance with the CARE Act, and there's kind of a deadline of January 1st, 2022, or whatever the Treasury regs are as far as your deadline to amend the plan. So ultimately, yes, you will, but you can go ahead from an administrative and operational standpoint, operate your plan in accordance with the CARE Act and then amend it later.
And
Hey,
how about
Heather,
any other?
I'm sorry, Eric. I'm saying, Heather, so that I think by amending their plans, that means employers don't have to offer these, right? Like you don't have to change your loan rules. You don't have to change your hardship withdrawal rules if you don't want to.
Right. I mean, I think that if your plan provides for the hardship distributions and if you provide for loans, these are, alternative, these are other ways you could open the loans and those things up. So if you provide for it, you would have these provisions in it.
Any other CARE Act issues that impact retirement plans?
Yeah, I mean, I think one of the things we're hearing about is the required minimum distributions. A lot of folks are worried about that. The CARE Act definitely talks about the fact that they're not going to be required for 2020. This happened in 2009. So the similar concept this year in 2020. And also, I know a lot of folks are concerned about deadlines and things like that. The CARE Act did provide, authority to the Department of Labor to extend deadlines. They included public health emergencies as a reason by which the DOL could extend deadlines. So, while it's not provided for in the CARE Act, we can expect, given that authority, that the DOL will probably extend certain deadlines, mostly the 5,500, which is what folks are looking at right now.
Thanks, Heather. Maureen, you're going to be popular because I'm getting a lot of questions relative health and welfare plans. So, a million years ago, back on March the 18th, the president signed the Family's First Coronavirus Response Act. I know that elements of this piece of legislation impact employer health plans. What exactly does the act require health plans to cover in terms of testing and treatment for COVID-19?
Sure. Thanks, Eric. Well, it does seem like that was a million years ago instead of just last week. We're kind of in a new coronavirus time frame these days. So the Act requires that all employer group health plans, and this is both self-funded and fully insured plans, cover the full cost of both testing and then the related visits for COVID-19 with no cost sharing. So that means no deductibles, no co-payments, no co-insurance. And visit is defined broadly to mean visits to urgent care, emergency rooms, and telehealth, so not just your traditional doctor's offices. We've had a lot of questions from plans that don't offer telemedicine, wondering whether they need to add telemedicine to their plans due to this provision. And the answer to that is no. It does not appear that you're required to offer telemedicine if you don't already do so. Just that if you do offer it, you have to offer it without cost sharing for the COVID-19 diagnosis. And note that the Act does not require plans to offer treatment at no cost for COVID-19. Not that there's necessarily a great treatment that we currently have available anyway, but whatever treatment is provided, especially, for example, for those who are hospitalized, does not have to be covered at no cost. Nonetheless, we're finding that many health plans are opting to cover treatment at no cost as well. And the IRS issued guidance on March 11th, more than a million years ago, stating that even high deductible health plans with HSAs can cover both testing and treatment for COVID-19 related visits at no cost without affecting HSA eligibility. Before that guidance was issued, this has been a big concern because of the prevalence these days of consumer-directed healthcare. We're seeing many more plans with health savings accounts, and HSAs cannot generally provide non-preventive treatments at no cost until a participant has met the plan's deductible. So employers were very happy to get that IRS guidance.
So what should an employer do ultimately if one of their employees either tests positive or there's a suspicion that they may have contracted the COVID-19 virus?
Yeah, so obviously that question is coming up a lot too. And sometimes HIPAA comes into the mix there. And so first I want to remind everyone that since this information came directly from the employee, it's not covered by HIPAA. Remember that only information coming directly from your group health plan is covered by HIPAA. Of course, you might still have a question about what to do. And likely the biggest concern is if you have other employees that may have been directly exposed to the ill employee, then you will need to inform those employees. And here we're suggesting that you carefully follow CDC guidelines, which are changing rapidly, like I said, in this world where new rules of measuring time seem to apply. There are CDC guidelines on what's considered direct exposure. Generally, my understanding is that refers to anyone who has been within 6 feet of the ill employee for a prolonged period of time. There isn't a definition of prolonged necessarily. So I guess kind of a common sense there. And so you have to disclose to those employees that they were exposed to someone who has tested positive or is suspected or has symptoms of COVID-19. But in doing so, you should be careful not to disclose the exact identity of that employee unless the employee consents. And we are having situations where, employers are asking and the ill employee is consenting, so then that can be disclosed. Because otherwise, although this information is not covered by HIPAA, as I said, it is still considered confidential under the Americans with Disability Act.
So a separate question kind of along the lines of the change from working in an office to working remotely. I mean, we've got a number of folks that are under shelter-in-place orders or some equivalent type of instructions by the state. And as a result, we're seeing either one of two things. Either kids are staying home with their parents who are working from home, or frequently daycare centers are obviously having to restrict capacity or shut down entirely in order to comply with the state guidelines. Can employees change their dependent care elections given what's going on?
Yeah, we've been getting that question a ton, as you might imagine. This is affecting so many people. So there hasn't been any special guidance issued for this or other sorts of cafeteria plan, mid-year election issues by the IRS at this point. But the good news with respect to dependent care elections is those rules are very flexible anyway, much more so than other cafeteria plan regulations. And they are flexible enough to cover this situation. So employees whose daycare needs are reduced, or perhaps they don't need it at all, can reduce or stop those elections prospectively. And then hopefully this whole situation will resolve sooner rather than later. And if they need daycare again and their needs change again later in the year, they can always elect to resume or increase their elections again.
Great. Thanks, Maureen. Summer, we're already seeing the first wave of layoffs. I think the report from the week ended the 21st was 3.3 million new filings for unemployment insurance. And certainly I think there's an expectation that the week ending the 28th is not going to be much better. At the same time, we're seeing some employers that are having to actually forego PTO because there's so much work to be done and frankly limited human resources to do it, especially on the healthcare side. And both obviously create different issues With hours being reduced by some employers, can employees elect to drop their health plan coverage?
Thanks, Eric. That's a good question, and ultimately the answer to that is maybe. It really depends on the plan and the situation. Generally, under Section 125 cafeteria plans, employees make their election, and they're generally stuck with that election for the entire year and can't make a change unless they've had a change in status event. If the reduction in hours does not result in a loss of eligibility, then traditionally that would not qualify you to make a change to your election. That being said, shortly after the Affordable Care Act came out, the IRS did add an additional change in status provision so that if a 125 plan so allows, if an employee meets certain requirements, specifically that their hours have been reduced below 30 hours per week, the definition of full-time employee for ACA purposes, and that person intends to enroll in another health plan, they can make a change within 30 days to drop their coverage. But you need to make sure that's in the plan and that the employee is meeting those requirements before they can make their mid-year change.
We also have a bunch of employers who are having to furlough or leave some employees during this period of time, but are trying to minimize the pain and are trying to determine whether they can extend health coverage for those that have been furloughed. What's the flexibility, if any, relative to that?
Right, and that's another good question, and one that seems to be coming up fairly often as well. And as a starting point, actually, depending on the situation, you may have to continue to offer coverage in order to avoid penalties under the Affordable Care Act's pay or play rules. Basically, for an employer that uses the look-back method, it's for determining full-time status of an employee. If that employee goes out on a leave or is put on furlough during a stability period in which that employee is considered full-time, the employee is still considered full-time while they're on that leave and would have to be offered the minimum value affordable coverage, or else the employer risks owing a penalty. So they could owe a penalty if that employee then goes out and collects the subsidy and the employer had not offered them coverage, they could owe a penalty on that front. Or if we're talking about a lot of employees and it drops the employer below the thresholds that they're offering coverage to fewer than 95% of their full-time employees, and one employee goes and collects a subsidy, the employer can then end up owing that ACA penalty for all of their full-time employees, even those who are still being covered. So that could be a significant issue for employers. But then you take kind of the flip side of things. If the plan doesn't provide for eligibility during that period, either because we're talking about a small number of people who might be out and they're willing to take the risk with that ACA penalty, or if it's maybe a monthly measurement period and they don't do it, but they want to continue to offer the coverage, well, then if you're not complying with you're being more generous in the terms of your plan, you can run into an issue with the insurance company for an insured plan, or if you're a self-funded plan with respect to the stop-loss carrier, who might be looking to not pay for those benefits if you're not meeting, following the eligibility rules that they had agreed to in providing the coverage. And then the other thing to, of course, remember is if coverage does terminate while somebody's on a furlough or leave, that would be considered a reduction of hours that would trigger COBRA coverage. And that's another big issue we've been seeing. Recently, there's been kind of an uptick in class actions on COBRA cases. And so to the extent coverage is being terminated, employers really want to make sure that they've reviewed their COBRA notices and that they're kind of up to snuff and providing all the information and being provided in a timely fashion so that they don't run the risk of having COBRA penalties apply.
What about the other end of the spectrum? So folks that aren't eligible to take PTO because the COVID-19 virus has impacted their work hours and expectations, and they can't be provided the leave. You have certainly some employees who might stop accruing PTO if they hit their caps under the employment arrangement. Can an employer let an employee cash out some of their unused PTO, especially in a time like this where they're restricted from actually utilizing it?
Yeah, you can really end up with some negative and unintended tax consequences if you do that without carefully structuring it. If you just allow employees and give them the option to cash out any unused PTO without imposing any sort of restriction, that raises the concept that the IRS has regarding constructive receipt, which would basically provide that if you offer that ability to everybody and kind of make it available, then everybody is subject to current tax on that amount that they could elect to cash out, even if they don't cash it out. So you get kind of an ugly situation where somebody doesn't take the cash and yet it still has to include that in their income currently, which is not something anybody wants to see. There are some ways, I know, obviously that's ugly. There are some ways to avoid that, right? And that's actually one that really comes up a lot, and it surprises people because it's kind of counterintuitive and not one that people would expect, that just because it was made available, if they didn't do anything, they'd still be subject to the tax. But you can avoid that if you impose a restriction or a penalty. So sometimes you'll see employers provide that if an employee wants to elect the cash out, they'll get 90% of the PTO amount, which solves the constructive receipt issue, so that only the people who actually elect it would have it included in their income. But that can also raise employment law issues in some states, and so may not even work depending on where the employees are. Employers can also allow for employees in this year to elect to cash out PTO that's accrued next year. Unfortunately, that obviously doesn't really go very far or help anybody with the current issues and what's going on right now. And then we have also seen, in order to address these issues and avoid the cash outs, we've seen some employers considering removing the accrual cap for all or at least an affected group of employees.
So this is a question for Summer or for anybody really on the line. So are there any legal considerations or recommendations relative to voluntary sabbatical programs?
I mean, I guess you end up with some of the same types of issues. Even if it's voluntary, you still have the same ACA issue I was talking about, where if the person's in a stability period and they're on a voluntary leave, if they haven't actually terminated employment, they're still considered a full-time employee from an ACA standpoint. So you'd still want to think through those issues. And then again, the same issue where you want to think through, if they're on the voluntary leave, if they're still meeting the eligibility requirements for coverage under the plan on the flip side of things.
And the COBRA issue too. I think you'd still have to worry about that, right? So can I ask Summer, just one more question too? Just I know we've gotten some questions where people have wanted to let people make PTO contributions to their 401k plan. Can you maybe just mention that for a second?
Right. There was some guidance, I think it was around 10 years ago or so, from the IRS talking about the ability to have PTO be put into the 401k plan, either as and viewed as an employer contribution or as an employee deferral. That's another one, though, I think that's not going to necessarily help people this year, because that would all have to be for next year, and you would have to amend your PTO policy and your 401k plan and look at the specific requirements in order just to make sure that gets structured properly. But it wouldn't, there's nothing I think that would allow you to do that this year.
Thanks, Summer. Hey, Eric, so in addition to, we talked a little bit about participants getting money out of plans and the impacts of that. We clearly have other employers who are looking for ways to try and preserve cash during this period of time until economic demand picks up. For employers that are looking to try and reduce savings, can you give us some options relative employers who may want to, reduce or suspend their contributions that they're making to the defined contribution plan? Can they do that now, or do they have to defer that to a future date into 2021?
Yeah, and that's a great question, and it's one we're definitely starting to see quite a bit of. And the answer is you generally don't have to wait until a long date in the future, but it's going to depend on what your plan document says and the type of contribution at issue. And so when you look at your plan document, And when I'm talking about the type of contribution, I'm talking about either safe harbor contributions to what's called a safe harbor 401k plan, which is a special plan design that allows an employer to forego certain non-discrimination testing. If you have a safe harbor plan, you probably know it. One of the defining features of a safe harbor plan is that you need to send out a notice towards the end of each year that explains the contribution structure and certain other plan design features. And for these plans, these are really the ones that are going to be the most restrictive as far as a company's ability to stop contributions to the plan. It's not that you can't do it, but there's a few more hoops that they make you jump through. But actually, as an initial matter, just getting a little bit off, not on off topic, but if you have a union plan, that would kind of throw another wrench into this, because your collective bargaining agreement is likely going to provide for these contributions. So you're going to would need to deal with the union issues in addition to kind of these specific IRS requirements. But as far as the safe harbor contributions, you can stop contributions mid-year in two circumstances. So either your company's operating in an economic loss, or you included language in that safe harbor notice you sent out at the end of last year indicating that the plan can be amended to suspend or reduce contributions. And so in either of those situations, you could send out a supplemental notice to participants that would explain that the contribution is being suspended. And this notice needs to be set out 30 days in advance. And if it relates to a safe harbor matching contribution, you have to give employees a reasonable opportunity to modify their deferral elections, which usually isn't an issue because most companies allow people to change their deferral elections often on a payroll period basis. Now, one kind of nuance I did want to mention relating to the safe harbor notice is at the very end of last year, I think it was late December, Congress passed the Secure Act, which eliminated the safe harbor notice requirement for non-elective contributions for purposes of ADP testing, which is non-discrimination testing for generally for elective deferrals. But the guidance didn't address the interaction between this Secure Act and these rules regarding mid-year suspensions. Now, this is something I anticipate the IRS is going to address at some point, but obviously, given everything that's going on, the IRS has a lot on their plate. And so, kind of given the lack of guidance on this issue, the conservative approach would be to give kind of this supplemental suspension notice 30 days in advance of suspending safe harbor contributions, whether or not it's a match or a non-elective contribution. And when I say non-elective contribution, that's oftentimes it's called a profit sharing contribution. And what that is it's an employer contribution that's made to the plan without regard to whether or not the employee makes an elective deferral. And in addition to that supplemental notice, you're also going to need a plan amendment. That plan amendment is going to need to be signed before the effective date of the suspension. Ideally, it would be signed before you send out the notice, just so that clearly there's no miscommunications and things as far as people changing their mind, and you're making sure that the communications are consistent with what is being done. But there are some considerations you're going to want to think about when you are deciding to suspend these contributions other than just the immediate cash need to the company. One of the things is, so as I mentioned before, these safe harbor 401k plans, they're intended to allow an employer to forego certain non-discrimination tests. If you were to suspend the contributions this year, you're going to be subject to those non-discrimination tests. And this can be an issue because the reason a lot of companies adopt a safe harbor 401k plan is because they can't pass this testing. So that's not always the case, but that is something to be considered. You're also going to need to fund the safe harbor contribution through the date of the reduction or suspension. So if you sent out a notice today saying that the safe harbor contribution is going to get suspended effective May 1st, the contribution would be made through April 30th. And as I mentioned before, there's other types of contributions. So, I mean, you could have a contribution formula that's baked into the plan document. So it says, we'll match 100% of deferrals up to 3%. Or you might just have a discretionary match or non-elective contribution. In those cases, you're going to really want to look at the plan document and communications to see if there's any restrictions on your ability to reduce or eliminate the employer contribution. And one thing to keep in mind is you can't eliminate the contribution if people have already met the conditions necessary to receive the benefit. So if you had a match that didn't have any conditions other than somebody making a deferral, you would still have to make that match with respect to the deferrals that have been made. And you are going to need to have a plan amendment if the benefit formula is baked into the plan document.
Eric,
yeah,
we've been getting a lot of these questions, Eric. So just maybe to go back over this one more time, because you talked about a lot of different types of contributions. That in almost any case, there's probably something that you can do to reduce or eliminate a match or an employer contribution, right? Number one, you need to look at your plan and make sure to see what it says. If it's a safe harbor contribution, then you have to take that extra step and look at the notice, and you actually have to provide notice to participants, legally required notice, right? If it's a safe harbor plan that you're trying to amend. If it's a non-safe harbor plan, there isn't necessarily a legally required notice, I don't think. It's just obviously be a good idea to notify people, and you still want to give them time to take action. But we've had that question come up too. Is there a legally required notice on the if it's you want to reduce an employer contribution or a match to a non-safe harbor plan? And I think the answer to that is no legal requirement to do so, but obviously a good idea. And I think, like what you said, you need to check your plan and see what it says.
Yeah,
Right.
Yeah,
Okay.
so you're going to have summary and material modifications, but that's not an advance notice requirement. So that's right. Yeah.
Right. Okay. Thanks.
What about we've talked a lot about the defined contribution 401k 403b side. What about the pension side?
Yeah, and then so there's kind of two questions on the pension side. So I mean, the first is ongoing benefit accruals, and so you can freeze benefits under a defined benefit pension plan, which at this point a lot of defined benefit pension plans are frozen. But if you have an active plan and you want to freeze it, you'll have to adopt a plan amendment, and you'll send out a special notice to participants, which is called a 204H notice, which will generally need to be sent out at least 45 days in advance. And it's important that that notice contains all the necessary legal bells and whistles as far as content and delivery, because if you don't give that notice properly, that can turn into a little bit of a mess and create some headaches. But in addition to the future benefit accruals, one thing that I think we're seeing a lot of are companies looking at the contributions that they're making to the plan in order to fund it. And I just want to see, Heather, did you have thoughts on that?
Yeah, absolutely. And so there again is going to be some, again, assuming that it's going to be passed as the way it currently is, there is going to be some relief in the CARE Act. For example, for those employers that sponsor defined benefit plans, the minimum contributions that'll be due during 2020, they're now going to be due into January 1st, 2021. However, it is important to note that while the due date is delayed, interest will continue to accrue. So when it is paid, you'll have to include interest with that. So there will be a little bit of relief there. There's also going to be some relief with respect to the adjusted funding target attainment. This was put into place when Section 436 was amended in the Internal Revenue Code. And so what's going to happen there is that the plan, and this is when you have to look at a plan status for benefit restrictions, when you have to start restricting based on the percentage of funding. You can use the 2019, what we call the AFTAP, and you can use that for 2020. So there's a little bit of relief there. And what I do want to mention, and I apologize for going back, is because I don't want to confuse anybody. With respect to the question on plan amendments, I do want to note that there might be some plans out there that currently don't have loans or don't allow for hardship distributions. The one thing there, the little nuance there, is that you could, if you decided that you wanted to do it, and you wanted to provide for these loans up until the amount provided for under the CARE Act, and or you want to extend hardship distribution to your participants, if your plan doesn't currently provide for it, you can go ahead and offer them and not amend the plan before you can offer it. But I would want to note there on the amendment, you would want to do it by the last day. So if you have a plan year 12/31/2020, you would want to do it by the last day of the first plan year. And the reason for that is it would be, you'd be putting into place a hardship or a loan provision. So I didn't want folks to think that they could move forward with the provisions of the CARE Act once it's passed and think they had until 2021 to amend their plan. There is that little bit of nuance that if you don't have it now, you'd have to do it by the end of the plan year. So hopefully, sorry to bounce back on that issue, but I want to make sure we're clear for those folks out there.
Hey, actually, while we're there, Heather, we had a couple of additional questions pop up on the hardship stuff. I mean, so hardship and in-service distributions, but does COVID-19 distribution allow for in-service withdrawals or only early withdrawals by terminated participants?
Well, so this provision appears, it would appear to be an in-service distribution, because arguably that if your 401k plan currently offers, let's say, a 59.5, right, you couldn't take any distribution prior to that. Well, you could take the hardship, subject to the 10%. So now this would just be an in-service or a terminated subject to meeting the requirements of an individual. Because if you're terminated, you could take a distribution at any time. Sure. So this is only really for somebody who's currently in service, who has no other distribution option available to them. This provides the alternative to them.
Is there any guidance relative to the Roth source for hardship distributions? There isn't in the CARE Act, but I want to caution folks and make it very clear, this CARE Act has not passed. So please don't anybody move forward with anything that I said, just to be very clear. Once it does pass, we will get so much guidance from, I assume, the IRS. There's going to be just a plethora of guidance out there, and hopefully one of those might address the Roth provisions and how that applies. But on my read of it last, I did not see any guidance relative specifically to the Roth. And the same, I assume the same guidance would be true of spousal consent, where it may be harder to get a notarized document today than it was, 2 months ago. We could get some guidance there potentially as well. And I did see, and I apologize because we've had so much between the Families First Act and now the potential for the CARES Act. There is guidance in one of those, and I remember seeing that there is some relief because of the notarizations and things like that, and I'd have to go back, but I know I just can't remember if it's under the Families First or if it's under the CARE, that there is some guidance for like notarizations and things like that, because obviously you'd need that if you had to get spousal consent. But I didn't see anything like waiving spousal consent or anything like that. Great. Specific. Hey, sure. Eric, we had another question pop up, maybe going back to the defined contribution side, just to make sure we're clear on this, because I know we talked about safe harbor and then you and Mike talked about other plans. So if you had, let's say you had a non-safe harbor match, let's say it's 50% of the first 6% of pay. There's no allocation conditions, there's no last day, none of that kind of stuff, no hours requirement. Can you amend mid-year prospectively, or are you stuck because people have already begun making contributions, presuming that schedule?
Yeah, and that's a good question, and it's one that I think I've seen people take different positions on as far as how conservative they are, and whether or not it can just be amended prospectively. There's definitely a reasonable argument to say that you could suspend the match with respect to future elective deferrals. I think it's pretty much everybody agrees that you can't do it for deferrals that have already been made, because obviously a condition of receiving the match is the employee making the elective deferral, and the employee made the elective deferral on the assumption that they'd receive the match. I have seen some people take a more conservative approach that it should be delayed until the next plan year if there's not an allocation condition. But I think when you analyze, or if it's kind of analogous to the safe harbor 401k plans, that those don't have allocation conditions, and the IRS lets you reduce or discontinue those. So I think it is a reasonable approach to suspend those prospectively, typically.
What about employees who have had their hours reduced or their pay cut? Can they stop making contributions so that they obviously would increase their net take home?
Yeah, and especially for somebody participating in a 401k or 403b plan, that's usually pretty straightforward and something that can be implemented pretty quickly. Employers often allow people to change elections on a payroll period basis. Now, if you have executives or other highly compensated employees that are participating in an additional retirement plan, which would be a non-qualified deferred compensation plan, a lot of times it's called a supplemental executive retirement plan or SERP or something along those lines, the ability to suspend contributions to those plans is more limited. In that situation, it would have to be an unforeseeable emergency, it's similar to a hardship. Essentially, you have to have a financial hardship resulting from kind of unforeseeable circumstances that can't be met by other financial means. We don't see it come into play a ton, but obviously this COVID-19 situation presents some unique circumstances. So executives might be able to take advantage of that on a case-by-case basis.
So Summer talked a lot about the reductions in force and the impact on health and welfare benefits, other related benefits. Will companies be required to pay severance if there's a RIF?
Yeah, and so I think the answer is generally, well, the answer is probably it depends. So you're going to want to first know if your company has a severance plan or policy, and if so, if this situation and this RIF would be covered under that policy. I also do recommend checking with a labor and employment attorney to discuss state-specific laws and what requirements you might have under those. But as far as the severance plans themselves, one thing to look at if you do have a severance plan is whether or not the severance plan provides the desired level of protections for employees and the cost of providing these severance plans for these benefits for these RIFs, because we're seeing a lot of fairly significant RIFs, and these benefits costs really do add up. And so one of the things to look at also is your company's ability to amend or terminate these severance plans. And generally the way that those are written is you can typically amend or terminate them for benefits not in pay status, but it's going to depend on the terms of the plan. So you're going to have to look at your plan document, but that is a common way that they're drafted. One thing to think about is the procedure required to amend or terminate the plan. If you were thinking about having a RIF tomorrow, you're going to want to know sooner rather than later if your plan requires that your board terminate the plan or amend the plan, if that's something you'd want to do before the RIF. And I also recommend taking a look at arrangements with executives. So you're going to have employment agreements that might provide for severance, and SERPs and retention bonuses may provide for accelerated vesting or payment upon involuntary termination.
Hey, Maureen, we had some additional questions flow through that I thought I might ping off you and see if you got some thoughts on. I mean, so related to the COVID-19 testing, do you have to cover out-of-network providers at no cost sharing? And if so, can you limit the amount that you cover to your in-service, your in-network allowed amounts?
Yeah, so I don't think we have a good answer to that question yet. And so I think we're kind of waiting for more guidance on this. And I've seen employers taking, or their TPAs taking different positions on that one. They're probably safe to limit it to in-network at this point, as long as their networks are adequate, but we really don't have guidance, and so we'll watch for more clarification on that.
How about now that with employees working from home, you mentioned HIPAA and the ability of employees to self-report, kind of exempting you from HIPAA, but would it be permissible to ask that employees report to corporate benefits if they've contracted the COVID-19 virus or have symptoms?
Yeah, in fact, you absolutely should be doing that. Employees should be required to report if they have symptoms, and you should be asking them to stay home if they do, so that they don't expose others and they're quarantining. And there are some, we have some really good in our COVID-19 Resource Center available at faegredrinker.com, I think it is. If anybody else on the line has a better link to that, or perhaps we can give one to Eric to send out. We have a lot of answers that give employers a lot of direction on sort of those employment-related pieces, because there's so much, as I said, that's changing day by day. in terms of guidelines from the CDC and the DOL and so forth on what you can do in those can and can't do for those employment situations.
One I'll throw out for the whole group or anybody who might know, have you heard anything about extensions for the 1094Cs under the Affordable Care Act?
I have not seen anything yet on that. That's an excellent question.
I haven't either, and I actually just got that question today because I think March 31st, right? Which obviously is coming up really soon. So I would be shocked if we don't get some sort of delay.
Which maybe ties back to the same due date for the 403B amended restatements. As I assume, at least last I saw, I hadn't seen any delay in that particular date, but hopefully, potentially one coming. Maybe, hopefully.
That's a good question as well. I have not seen anything. Oh, sorry, Maureen.
Oh no, actually, this was Heather. You know what? I actually just looked at it yesterday, and I haven't because I have one that we're pending to sign, so I haven't seen anything yet. But again, similar to the other thoughts, which is I'd be shocked if we didn't get some sort of delay in that.
Hey, Eric, one more kind of scenario relative suspension of employer contributions. So, the first example I had was a 50% of sick with no allocation conditions. What if we had an annual year-end match, right? So 50% of sick, but we didn't make it concurrently. We made it at the end of the year. Would the same be true that, like a safe harbor, while there's not clear guidance, we could at least amend prospectively with some notice period, and that while not, expressly talked about in any of the regulations, would seem to be a good model to utilize?
Yeah, so I think kind of as an initial matter. So if you have an annual match, and for example, you have a last day requirement, that one's the easier answer because nobody should have a right to the benefit yet, except you might have some exceptions for people who, retired or became disabled or died or reached normal retirement age or something like that. Then in that situation, those individuals wouldn't be entitled to the benefit. So it'd be pretty clear cut that you could eliminate that prospectively. As far as if you didn't have allocation conditions, then it's kind of a similar analysis that, it's not really necessarily black and white. The concern is whether or not there's a prohibited cutback. Is a person's right to the benefit their right through their compensation accrued through the date of the amendment, or do they have a right to have the contribution based on their contribution for the entire year? As I mentioned, I think there's a reasonable argument you can make that it's based on their contribution only through the date of the amendment. But the more conservative approach is to wait until the following year. So I've seen people take both approaches here.
So maybe with that, I think we'll bring today's audio cast to a close. I know folks are tremendously busy. We very, very much appreciate your time. To the earlier comment, when we send out the recorded materials, we'll send links to the resource centers available with some of the documents that were referenced during today's discussion. To the extent that you have additional questions that we were either unable to get to, or that may occur to you after the fact, please feel free to let us know, and we'll get them distributed to the right parties and try and get answers back to you as quickly and efficiently as we can. I want to thank everyone for participating in today's audio cast, both you in the audience as well as my fellow panelists. We hope you have a fantastic day. Wish you all the best of health. Thanks.